on the ride home, actually, I had mentioned to my friend that I was going to marry her. And Katie actually was pretending that she was passed out.
Finally, I just kind of snapped at work. I came in sobbing, like something is wrong with my child. I don't know what this is. I confided in my boss, who's a pediatrician, and he's like, I know exactly what this is.
Take a girl and a guy, and they fall madly in love and form a family. Sprinkle in some counseling degrees and a doctorate, a dream of transforming relationships as we know it. And 20 years later, we give you power couple Dr. Ray and Jean Ketkodian. And this is their podcast, Couples Synergy.
Welcome back to another episode of Couples Synergy with Dr. Ray and Jean. Hi, I'm Dr. Ray.
And I'm Jean, and this is our podcast about love, marriage, and relationships.
Be sure to check us out online on our Facebook page and Instagram at Couples Synergy or our website, couplesynergy.com. And be sure to subscribe to our podcast or send us any suggestions on topics you'd like to hear more about. And now on to Couples Synergy, an in-depth look at love, marriage, and relationships, where we bring you our experience helping thousands of couples transform their relationships for nearly 20 years.
You know, every day we get to hear intimate details about a couple's celebrations, disappointments, and everyday challenges. We've often wished these stories were shared because we know we are more similar than different. So we've created not only an avenue where you can hear about people's intimate lives, but an atmosphere where people come over to our home pub, pour a drink, and share their stories.
People like today's guests, Mitch and Katie, thank you so much for being on our podcast today.
Thank you for having us.
Thanks
We're excited to be here.
Before we get into your story, why don't you guys tell us a little bit about yourselves? How old are you? What do you do for a living? And how long have you been together?
My name is Mitch Kino. I am 34 years old, about to be 35 here in a couple weeks. I'm a director of product management and marketing at a medical device company here in the North Shore. Katie?
I'm 33 years old. I'm a lactation consultant, mom of 3. Mitch and I have been together for 12 years now, married for 9. Yeah.
Wonderful.
And can you tell us the story of how you guys met?
Whose side do you want to hear?
Both.
Let's hear both sides.
Great. So we met my senior year, Katie's junior year. We had both actually...
Of college.
Yes, of college. Thanks for the clarification. We both just recently got out of fairly long-term relationships previously. And both of our mutual friends that were dating set us up on a true blind date, actually. It was a barn dance, which if those listeners who don't know about a barn dance, it's a college fraternity get-together where you take a bus out into the middle of nowhere. There may or may not be alcoholic beverages involved.
Is there really a barn involved too?
There is a barn, and it's a very nice barn because I think that their entire business model is designed to help support these types of parties.
A very nice snack lady who passes out Chex Mix.
Yes. So in any regard, had a few beverages, spent a decent night together. On the ride home, actually, I had mentioned to my friend that I was going to marry her, and Katie actually was pretending that she was passed out because I think I had indulged a little bit too much. And at the conclusion of that ride, Katie ran off the bus, said goodbye, and we didn't see each other for maybe about 90 days. Thereafter, we had a class together. She needed a little bit of help writing an essay. I'm not good at writing essays, but I really tried hard to make sure she got a better score than she would have writing it herself, and then the rest was history. So,
were you really pretending that you were passed out?
I was pretending I was sleeping on his shoulder on the way home. It was probably 1 or 2 in the morning, and I overheard him say, "This is it. I'm going to marry her." This was like 5 hours after meeting.
Yeah.
What were you thinking?
I mean, he had way too much to drink that night. We did have a great time. I had just gotten out of a relationship, so it was just like a fun night out. And I'm glad he pursued me further a couple months later, and I got to know the real side of Mitch. So,
Why didn't you pursue her sooner?
Well, that's a really great question. Not something that I think I've ever spent time thinking about. I probably was just in the exploration mode after a relationship, trying to figure out what my next steps were. The relationship I had wasn't super happy in, and didn't have an opportunity, I guess, in college to like have a good time. A lot of restrictions, I guess, or conflicts previously. So that's probably the main reason. I just wanted a little bit of time for myself and let things kind of play out.
Why did you say that you were going to marry her?
Her smile, super sweet, very kind, passionate. Even within, yeah, I guess a matter of moments, I guess. So
we hear that all the time.
Yeah, there is such true thing as love at first sight. I mean, we lived that. So,
how about for you, Katie?
He just wasn't like the typical college guy. Like, he was always making me like Asian cuisine and always took me out of my comfort zone. Like, let's travel here. Let's do this. Let's do that. I've never tried this before. And I was nervous and excited, and it was something different all the time. And I mean, it's still what I love about him to this day,
So how long did you guys date before you got engaged?
Well, that's a complicated story. We could probably have an hour podcast on that alone. But so we started dating probably late fall of 2008 or 7. And
2007.
2007. I had graduated, and to no surprise, I wanted to be off elsewhere. And so I took a job with the Department of Defense on the East Coast. While Katie was finishing school. You finished school a semester early, and then she came out that way to finish her education and become a nurse at Virginia Commonwealth University in Richmond, Virginia.
I was ready to go to St. Louis University. Mitch flew me out several times to Richmond, Virginia to show me what a great time it was on the East Coast. Wined and dined, probably got himself into some credit card debt.
True.
But I did end up falling in love with you and the city. And I came home and I'm like, Mom and Dad, I'm moving to Richmond in a couple of weeks. And then I moved out there.
The only problem was if you've worked for the government or perhaps been a soldier in the military, you know that you don't stay anywhere too long. And so the premise of Katie coming out was quickly overturned by a number of different short-term stints at various parts in the United States. And so that was challenging.
I think about 3 weeks after I got there, and it wasn't far, but it was the first time I was away from home. And he quickly had to leave. So
yeah.
Wow. So you move out there to be with him, and he leaves.
Yeah.
Yeah.
And not by your choice.
Not by my choice, but tried to heavily influence where those assignments were. And then the question you asked was, how long did we date before we got married? But
so I think a year after that was when we found out we were pregnant.
Yeah. So I was based in Aberdeen Proving Grounds, Maryland, which is just north of Baltimore, while Katie was at school. So it wasn't a far drive, and obviously we were spending weekends together. But after we found out we were pregnant, yeah, again, another long, very complicated story. But
I should add that was the moment it sealed the deal for me. I mean, he was 24, I was 23, and as soon as I told him, he broke down and was like, "This is the best day of my life. Like, this is so exciting." And I just don't know like many 24-year-old guys starting out to have that kind of reaction to that kind of news. And I've never seen you smile that big. You were so excited. I was so scared, and I was excited as well. But, the timing was off. Everything was off, but he was just so optimistic about it.
What kind of reaction did you get from family?
Mixed disappointment, excitement, probably fear for us, being out somewhere that we didn't have the help, the guidance, the support.
I was still finishing school.
Yeah, she was doing clinical hours up until the day before, I think, honestly.
On a total artificial heart unit.
Yeah.
Yeah.
I think your parents were maybe some of the more challenging folks to kind of win over. And I don't know that they saw the light or the picture, like the total end game of kind of where we were headed. And so,
Yeah.
That's always fun for parents.
yeah.
We just actually went and visited our son. He's in DC. And I always think about, when my parents visited me, what did I want from them? And of course, what you really want from them is for them to say, you got this and you're doing a great job and, you'll figure it all out. So I think we've done pretty good at being parents like that to our grown children.
Mm-hmm.
But it's hard when you see them go through something pretty big like that.
Yeah. Something that's not
So you guys
part of
aren't
the plan.
married.
Right.
You have...
You're not engaged yet either, right?
No.
Okay.
And you're in Virginia.
Mm-hmm.
And you have a baby.
Yeah.
What happens then?
I had a couple professors say, we told you at the beginning of this accelerated program, like the two things you can't do are get married and get pregnant because it's just not possible during this program. And for anyone who knows me, that fueled my fire, and I finished and I got to walk across the stage with my little baby. And I got to have my favorite cheerleaders. And at that point, my dad was head over heels for Graham. And everyone was. We were all.
Yeah.
It was a great time.
Fortunately, due to those good essay skills I talked about earlier, I wrote a letter to my leadership team and, peers asking to be able to work from home in Virginia, which they honored for about 6 to 7 months. Pre delivery of the baby, and then they said, well, now it's time to come fulfill your duties at the location. And at that time, I think Katie and I both wanted to continue expanding our presence in Richmond, but didn't have a great network there in terms of helping find opportunities for another career. And so whereas looking back home here in the Chicagoland, it was many opportunities. And so we made the decision that we would come back home for family.
Mm-hmm.
And so I found a job in supply chain and moved back, and then, started our life here back home.
So at what point does the engagement and marriage happen?
We got engaged. I was 7 months pregnant, 6 months pregnant maybe. And we just had a quiet night out, and he proposed in some gardens in Richmond, and we waited until Graham was 1 year, almost 1 year.
And what did people think about the news?
Oh, they were so excited.
Absolutely.
So excited. Yeah.
I think, from a third party view, it was obviously the right thing to do, but it wasn't just the right thing to do. It's also something that we were both mutually interested in doing. So I don't think there was any question or hesitation.
Is there an engagement story?
There was a couple times I thought he was going to do it, and it never happened. And then I did have a feeling that night he was going to propose in that garden.
There was no like airplanes blowing smoke, like asking you to marry me, or it was.
He got down on a knee and
Yeah.
said, I would love nothing more than to spend the rest of my life with you. And I was pretty hormonal with my baby bump. And
So how does the relationship progress from there?
I think it's an interesting story because, although we both wanted it, I don't know that we were necessarily ready for marriage and to have a child. We tried to pursue the things that we thought were best, which was, getting a home. Katie went back to work.
and everything you think you should do isn't always what you should do. Like, we bought this townhome and it wasn't the right fit for us. It was like surrounded by a lot of retired folks. And then I thought I took this job that was like 3 12-hour shifts away from Graham, and I was just really getting the hang of motherhood and enjoying it, and I didn't want to leave, so I quit the day before the position started and took some time at home, which was great. And Mitch was always super supportive, and I think we just kind of like grew up together in our 20s. It was rocky when we came home.
Yeah.
There was a lot of time you wanted to spend with your friends that you had lost. We just had to figure it out. And grow together.
Yeah, I mean, there definitely was friction, I'd say, on the social aspect. For me, feeling like, well, I've been gone for a couple of years, I haven't been with the bros, going out downtown. And so there was definitely for me FOMO, they're calling, they're texting. And then if you were to make a line graph, you would look at the horizontal axis being time. And then whatever the vertical axis is that the calls, stopped coming, I guess, because it was like, can't go, sorry, maybe next time. Yeah, thanks for offering, but no. And so I think I was resentful. I don't know that, and I think I own a lot of that, quite honestly, because I think Katie would have supported me, but wasn't sure, but just didn't feel like that was the right thing to do. So that caused, I think, some conflict.
I think that's a really normal part of especially becoming parents, and your whole life changes, right? And everything, the hanging out and the freedom and traveling and doing whatever, there's another priority now.
Mm-hmm.
And a lot of couples have a hard time adjusting to that.
I think
Especially
after the move too, like when we were on the East Coast, it was so much easier to just be present with your significant other because we had friends, but they were more mutual friends. And then you come home to your where you grew up and went to college, and everyone is downtown and no one has kids and everyone's going out, and he's, trying to have, a foot in both pools, and it was a really hard time.
Yeah, I don't think we were successful at all navigating that, if I could be honest.
Well, you guys have faced several challenges as parents, right? Did you guys want to talk about that?
Yeah, I think there's a number of stories to be told, but maybe you wanted to share a little bit about Nathan.
Yeah, so, we had the first few years having our second child, Nathan, was, they're all we have 3 children, they're all 3 years apart, and really smooth first couple of years, and when he was 4.5,
2 years ago this...
Yeah, 2 years ago
this
month. Probably next week, 2 years ago exactly. I was pregnant with our third, and he had a series of impetigo. I don't know. It's a strep infection on your skin. So a lot of wrestlers get it, and kids get it, and it's very treatable with an antibiotic ointment. And to be honest, I was busy working. I was busy momming, and I probably didn't bring him in as often as I should have in hindsight for it. But it was chronic. It would come every couple of months, go away, come back. Then he actually had strep throat 4 times in a row the following summer. So he was a little shy of 4.5 at that point.
Was that related, the strep throat?
Well, we think it was one chronic strep infection over the course of about 9 or 10 months that just never went away, but it kept popping up in different places.
It's almost like...
And he never actually had a sore throat. It was Mom, I have the stomach ache, and I would, he had this terrible breath, and we'd go in and it would be strep throat. And the doctors were shocked, and he'd test positive, and we'd go back 10 days later, re-swab, still positive. Went back a third time. It was 3 different antibiotics, still positive. Finally, I can't remember the antibiotic that did it, but got it out of his system. We thought we were done with it. I had a lot of morning sickness at the time. Mitch had a job that was a lot of travel at the time. So a month after things we thought were normal, he woke up one day and was just a different child. He had a lot of behavioral regression, bedwetting, tics,
paranoia, OCD. His
eyes were glazed. You would have thought he was possessed. It was at our oldest son's 6th birthday party, and Mitch and I looked at each other like something is very wrong here. He was just screaming that he couldn't put his shoes on, and his socks didn't feel right, and
it's cliche to say, but it was a light switch. There was no progression.
There was no signs. I kept looking back, and there was nothing. It was one day things changed. And the first 3 days, I really kept it I think we kept it to ourselves, and was it a parenting mistake? What the heck is going on?
Yeah. Is it behavioral? Was it something we did? I mean, yeah.
Yeah. And finally, I just kind of snapped at work. I came in sobbing, like something is wrong with my child. I don't know what this is. I confided in my boss, who's a pediatrician, and he was amazing. He sat with me for an hour and a half while we both had patients waiting. And
Wow.
He's like, we'll figure this, they were canceling them on the spot. He's like, I know exactly what this is. And I've only treated a couple other patients with this, but it's something called PANDAS, a pediatric autoimmune neuropsychiatric disorder associated with strep infection, where the
also known as
strep
PANDAS.
PANDAS, yes. So there's an antibody that attacks your brain that thinks that there's still strep in the body, and it doesn't know how to turn off. So it was like this hamster wheel that kept going and going, and we are so thankful that they treated it so aggressively right off the bat. But
What did they do?
he was on antibiotics for close to a year, on and off, trialing different ones, and Motrin, a lot of Motrin around the clock. So
for inflammation in the brain, to help prevent and mitigate some of those the autoimmune attacking of the different neurological areas of your brain.
I mean, he had moments he was vomiting at the dinner table, gagging, weight loss. We had to have an occupational therapist in the house to even put his socks and shoes on to get out the door. I thought of quitting my job. I mean, I was pregnant at the time. It was a pretty dark time.
Yeah.
How did you guys go through that? Did it put a lot of stress on your relationship? Did it bring you closer?
I would say, I think it made us closer. And the only reason I say this is because when you have an illness such as that, by the way, it's extremely controversial diagnosis. In fact, if you were to
Some
ask...
doctors do not believe in it.
If you were to ask 10, I think more than 5 would say, no, you need to be on antipsychotic medication. So I think what we felt was a lot of eyes peering in, maybe questioning.
Lots of judgment.
What we were doing at home. And so I do feel like it brought us closer. And I'm surprised, looking back now, at how well we managed together. I think you had quite a bit of anxiety and you were very, very concerned, as was I. But I was always hopeful, trying to be grounded, to balance the situation. But
I mean, I was up till 3 a.m. researching
oh my goodness,
every day for 6 months, probably, trying to just learn as much as possible because there was just such limited resources. And I think at a certain point, Mitch let me just get that out of my system. But I mean, there was nothing I could do. It was beyond my control. And I think you just learn to there were so many petty things I think we were focusing on before that maybe there was a reason this all happened, but you don't have time for that.
Is there an estimation of how many kids suffer with this?
Quite a few. I mean, they're talking about kids with a lot of tics and behavior disorders later in life that possibly had PANDAS. You would never know. There's a lot of research going on still, but more than you'd think.
Is there a way to diagnose it, or is it more like you're looking at all the clinical stuff? And
it's just putting pieces together. Luckily, he had such a strong case that was documented of repeated positive strep infections, where a lot of kids just maybe it went under the radar. Luckily, I'm a nurse, and I brought him in every single time I thought possibly it was strep, even though there was no sore throat.
We're extremely fortunate because Katie works at a pediatric office and has access to 8 very smart pediatricians. And oh, by the way, if you need to get into Lurie's or you need to get into a very high profile facility, we had access to that. And we all often think about how lucky and fortunate we are to have had that access, because you read some of these stories and, anecdotally you hear about them where they're teenagers, there are adults who have experienced this for much of their life and it remains undiagnosed and untreated. Or if it is treated, it's treated in one of those methods that I talked about previously. It doesn't help
underlying.
Yeah, it doesn't resolve
Just
root
treats the
cause.
symptom.
Exactly. So
Did you have any other doctors tell you it wasn't this? And
Oh yeah. Several doctors that pandas is not an entity. One hospital institution, very highly credible institution, just does not believe in pandas in general. It has to fall under autoimmune encephalitis, which has very similar characteristics, but you're immediately discredited in that feeling. I really do feel like I have some PTSD surrounding it, just really mama bear, doing the best for your child. But
I mean, I can recall a time we've saw probably 30 doctors in 2 years, right?
yeah,
From different entities, where you would say the word and they would just completely interrupt, or you'd see a facial expression where it's like, you're crazy. Like not even gonna acknowledge that you just said that, basically. And you know, I like to compare it to, you know, maybe autism, or, you know, where it wasn't widely understood. People didn't know how to react. People didn't know how to treat it, deal with it. And I think that this is something that's happening. And perhaps there's a wide spectrum of what we're describing today.
sure. As I gain more knowledge about the community, Nathan had a very mild case, and it was devastating to our family. But some of these families, I mean, the kids have suicidal thoughts or are trying to harm their family. Luckily, that was never the case with us. But I mean, it was still,
Yeah.
I mean, we wouldn't leave the house many times because,
Sure.
you know, was it going to be more of a hassle than anything to get out and get our shoes on?
how much of your intuition guided how he got treatment versus listening to, you know, just the doctors that were out there?
I mean, I was extremely persistent. I think I just knew something was very wrong. And when you're happy-go-lucky, he was like the classic middle child.
Oh my goodness. Yeah. Bright blue eyes, curly blonde hair, never serious, always fun. And then literally in like a snap, it was gone. And so it was very clear to us that this was extraordinary what was going on. And so, you know, I know you hear people talk about be your own advocate, whether, you know, it's for health or at work. I mean, we had to fight every day for someone to acknowledge our story, make a recommendation in a health plan to bring them
I think
back.
it took a good 3 months for our parents to even see and understand what was happening. I mean, it was like a weird tornado, you know, it was, you really had to be there to understand it.
Yeah. And I was really sensitive about sharing it. I was extremely sensitive about sharing it with our community and our friends, neighbors, because I didn't know what they would think. I thought he would be ostracized. I thought we might be ostracized. Overall, I'd say we have a good community. There may have been some subtle things at best that happened, but overall, we got decent support. Maybe not as much as we probably needed, but I guess it could have been a lot worse. But.
Yeah.
Because those symptoms would be very similar to a trauma or something else, like a big event.
Yeah.
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 And you know, I don't know the best way to describe this, but you know, children and adults, I guess, for that matter, when they're in a situation outside of their comfort zone, you figure out a way to cope. And so even if he was having problems, we perhaps would be at a friend's house and he would try to hold it together and they'd be like, yeah, I don't see it. I don't know what you're talking about. And at the end of the day, it's like, come by at, you know, 7:45 in the morning when we're trying to get him to school. And it was at sometimes 30 minutes to an hour just to get him to get his shoes on and convince him that it wasn't raining outside. Like those were specific instances that, and I wasn't there a lot. I was working, I was traveling. That was your mom, you and your mom. Like literally you had to be late to work because you were just.
We had the one time we had gotten a babysitter. He was under the bed, paranoid that the babysitter stole his candy, and he was so certain that she was just the worst person in the world, you know. And I remember that it was like the last date we had in 6 months.
Wow.
But he was stuck under the bed, just very paranoid.
Yeah.
What is the prognosis of this condition? I mean, is he going to kind of suffer with these symptoms for a long period of time?
So I think because he had such aggressive treatment, we saw a lot of improvement over the pandemic, to be honest, because his immune system had a chance to not be bombarded by other. So as time goes on, once you get past the acute strep infection, that goes away. Now every invader, like a cold, the common cold, will trigger a flare. And the same symptoms create the same antibody in the brain with mild inflammation. So it wasn't like anything it was at the way beginning, but I mean, you would see maybe 30% of what we had at the beginning. So still impacted our family quite a bit. And I wasn't satisfied with that answer for sure.
Yeah.
I wanted to keep finding a solution. But he had the first 3-month break this summer with no medication, totally happy boy, no issues in any way. And this last couple of weeks, we had to get back on.
Right. But
And
since
he's okay.
there's no firm diagnoses, you're relying on the parents' observation, intuition, which I mean, then you're basically taking science out of it. You know, I mean, obviously, if there was a positive strep infection, that would help lead to treatment. But there are times where, like, how did we not catch that earlier? And then there are also times where it's like,
maybe maybe it's not a flare. Maybe it really is just a stressful time. So there is no just like relaxing into parenthood with this situation. I think you're always overanalyzing.
Yeah.
Are there coping skills that he can learn as he gets older? Or is it so organic that it's just going to hijack him sometimes?
Some stuff, I think a little bit of both. He's done incredibly well finding things. You know, I see him adjust his socks when he's in a flare, and but he figures it out by himself, you know, get everything straight, see him take a deep breath and move on to the next thing. And I'm like, yes, he did it, you know, and there's some awesome milestones we've seen him just work through on his own that we're impressed by.
Did the school notice anything?
They did, but it took them longer. But his fine motor skills he would start to become dyslexic and write backwards during the times of a flare. So there were certain things I was able to document, take pictures of, that I would put together, and I think that really helped build the case. But a lot of people don't have that luxury to be able to build a case and show their pediatrician on a phone, like during a brief 15-minute visit. So I always count my blessings that I think we're in a very unique situation.
But logically, we knew he was going through a flare, and we would write the teacher an email, and there would be no corroboration. And it's like, so then the only way I was able to deduce was what I said previously, was he was able to cope, maybe not happily. I guess, unfortunately, for, you know, a 5-year-old, you know, we won't ever know. But I don't know if they didn't believe the diagnosis, or they, you know, I don't know. It was a very strange time, because it also was, I was looking for other people to acknowledge, and when, you know, our parents would see it, you know, it's like, okay, we're not crazy.
It did feel like a little bit of relief when other people would notice it. Yeah. Sadly.
You know, this kind of challenge that you guys have gone through, and, you know, other parents that might be kind of struggling with a child with special needs, that the tendency of that stress could either drive couples together or can drive them apart, right? And especially in your case, where you're actually fighting against the world, right? And everybody else has got their opinions and their judgment about what is happening in your home. You know, that I just couldn't imagine that kind of stress that the two of you are under and still under, right?
Yeah. At the same moment, we were doing testing at the time of his diagnosis. He had he always had a little left leg inward in-toeing, and
a bad gait, I guess.
Yeah. So they were looking into something called tethered cord syndrome, where it's an MRI. It's a pretty simple procedure. Right before he got diagnosed, actually, with pandas. The MRI came back negative, and my sister at the time was no, she's still my sister, but at that time she said, keep pursuing it. I know you're dealing with the pandas, but something's up with his leg too. So during the treatment of pandas, they took out his tonsils to like decrease the risk of contracting strep at all. And she's like, push for this brain MRI. Like, it just seems weird that their child doesn't usually into just on one side. I was kind of annoyed with her at the time, but I'm like, all right, let's just do it. So I pushed for it. That night, one of the doctors from my practice came to my house with the results, and I knew, I'm like, oh gosh, why are they at my house? He also has this brain disorder called Chiari malformation, which is totally separate and incidental finding.
Which is, in layman's terms, is your brain stem sags slightly less in your spinal cord.
Like 5 millimeters,
Yeah.
a little herniation in your brain.
So talk about compounding factors, because
So
now
I think we found out 30 days after the pandas that he had this other condition.
and now you're talking about two perhaps separate diagnoses. Are they related? Are they not? And so, yeah, things
Got crazy.
I mean,
so
the child,
some of the neurosurgeons thought, they just didn't, the ones that don't believe in pandas thought it was all Chiari. So they wanted to go open his brain and fix the Chiari and do this big brain surgery. And luckily my boss was just like, just ride the ride. This, you don't have to do anything right at this moment. Let's try to work on the pandas. Then you can get a more clear picture of which brain
disorder
this is. And I'm so happy we did, because I really think the Chiari was more incidental, and he's doing fine with that.
What are some of the symptoms of Chiari?
some can be almost similar or identical to...
Not as much psychiatric, though.
No,
not as
but the
neuropsych,
physical-
but some gait disturbance and joint matured enough, they said, by maybe his teen years.
So he could outgrow this.
He could.
Mm-hmm.
Wow,
Yeah.
that'd be great.
Yeah. I mean, I never thought we'd be where we are today. So, I mean, that alone is amazing.
What type of advice would you give to parents who are dealing with something, they're not getting good answers, they're confused, they're scared? What would you say to them? And what resources would you maybe think about offering for them?
I mean, reading is a positive and a negative. You know, you could read very quickly on any symptom that you have. You're dying right now. And, you know, obviously we're fortunate to have the resources we do, the education that Katie has in the medical field. But I'd go back to being an advocate, and then I would leverage some of the social media stuff out there, which again can be extremely scary as well. But I know that Katie exchanged quite a few messages with families and mothers who were in same situations that gave guidance, support, and empathy, I guess, really. So that was helpful. And then I would just say to talk about it. I mean, I wish, and I'm glad we're here talking about it today, but I wish we talked about it more and we advocated and we helped, you know, tell our story, because I think it's something that more people have experienced than we all want to realize.
Are there any official groups or organizations, you know, that are resources for parents out there?
The Pandas Network, and there's a lot of Facebook groups. You know, thousands of people are in this group in Illinois alone, and that was a great resource for us. I think my biggest piece of advice would be finding a balance of being persistent, but also, you know, it's a ride and you just have to go with the ups and downs of it and realize there will be, you know, some relief at some point. And I did not see that. I feel like I was in his body at that whole time, and I took that burden, and it failed the rest of the family, I feel like, at the time. And if I was able to take a step back, I don't think it would have affected everyone as much of the other kids. But
I mean, the other thing I just wanted to say is, you know, I know it's a little bit off topic, but, you know, we're also of the age group and maybe the culture today where we wanted to know, like, now, you know, and I think these things take time, and it helped us find a diagnosis. It helped us find treatment. but I think it caused a lot of, personal harm in the way that we were going through it. But yeah.
So, if we can get those resources from you guys, we'll put them in the show notes.
Absolutely.
For those out there that may be, searching and want some answers.
It's called Aspire, ASPIRE.
Great.
Awesome.
Yeah.
So we also know that you're kind of struggling with your other child too, right?
Another compound.
As we reached our best point with Nathan this summer, I thought we were like ready to move to a new home, turn a corner, rebuild the life a little. And right as we were closing on our new home, our third child, June, developed a right leg limp. And
swelling.
Yeah, go ahead.
Yeah, I mean, it was wild because, there was always another event around that time. It's not just they're swelling. Well, she got stung by a bee on her foot the other day.
It was probably that.
Yeah, coincidence or non-related. Very sad, very mobile, energetic third child, as you would all expect. Extremely social, trying to keep up with her older brothers. All of a sudden, was starting to show signs of weakness, unable to bear weight on the same leg that she was stung by her bee, and
then it would go away by 12 o'clock.
Think of this 2-year-old as a 9-year-old woman in the cold weather. You wake up, you're a little sore, and then over time you maybe get some lubrication, kind of work it a little bit more, and she becomes herself.
So how do you guys deal with stress?
Retreat backwards. No, I don't know. I mean, I try to get close to the earth, as quickly and as fast as I can. And then also potentially just block it out maybe a little bit and just, I can't change it. I can't influence her outcome and on the day-to-day, moment-to-moment, especially if I'm working, and just try to stay hopeful, I guess.
I think her diagnosis was so much more straightforward, and everyone recognized it. And it was
arthritis?
Like,
I know what that is.
Yeah. Yeah, this is what the blood work says. This is what it is.
So you got a socially acceptable.
Here's our treatment plan. I was like, oh, great. This is amazing.
Talk about empathy. A lot more empathy.
Yeah, I'm like, we're fine. This is treatable. Like this.
Is it because there's scientific evidence that they can pinpoint?
It's a word that everybody knows. Mm-hmm. When you say pandas, you think about the zoo. Or I mean.
So I think some stuff came up for me during this diagnosis. Mm-hmm. I'm kind of like, why is everyone treating it so different? I mean, it's terrible. We're gonna deal with it. She's super strong.
She's resilient. Yeah.
And it is very sad and heartbreaking, but at the same time, it's kind of makes you wonder about these other illnesses that don't, just because it fits in a certain category, you get certain treatment, or it doesn't seem fair.
I hear that a lot when someone has a parent that's at the end of life. Mm-hmm. And they're leaning on the medical community, and the medical community is like, I don't know. So if you have diabetes, talk to the diabetes guy. But if you have, a heart problem and none of the doctors talk, and you really realize how little the medical field actually knows. And I think we're sort of domesticated to believe that they know everything. Mm-hmm. They've got a plan. There's an answer, and there's many less answers than...
Absolutely. Yeah. It is an art just as much as a science. And I know that medicine is considered a science, but when you talk to a physician of any field, there is something that they need to contextualize, they need to consider, and unless it is positive of, yep, this is X or this is Y, there is some interpretation. Mm-hmm.
And lots of schools have thought about what to do with things. Mm-hmm. Mm-hmm. And I think especially if you have children who maybe they're not even of speaking age, where they can really say, this is what's going on with me. Your intuition's everything. Well,
right, because this morning she can't bear weight, and you say, does your knee hurt? no, daddy. Like, what is she doing? I mean, does she have the skills to understand? I mean, what is she communicating? Does she?
I mean, in her case, I think, you have to be her advocate.
Yeah.
And so maybe a little even stronger sense, because she really can't even say what's hurting and what's going on.
What advice would you guys give to couples who are dealing with a child that's going through something difficult, about what they can do to keep themselves strong and able to support their families?
One of the doctors gave me some really good advice early on with the panda situation was, would you let a cancer patient get away with, treating you poorly? And I think I let the kids get away with a lot during that time, and I realized quickly that did not work out. It just caused a lot more behavior problems, if anything, and muddied the water of what is this illness, a diagnosis, versus what can we do about it. And I think once we, and even with her arthritis, it's like, all right, we got to get up and moving. I know it hurts. I know, we got to run around. Let's make it fun. Whereas I could easily be like, okay, sweetheart, let's watch TV. We'll put another movie on. Like that would, part of you wants to do that, but I think keep chugging along and staying positive and making the most of it.
Yeah.
Is super important.
I would also say, and this is not something you'll hear me say very often, but talk about it, even if it's 10 seconds, a minute, an hour. It's not something I particularly like to do, is talk about things, but if you avoid it, it's going to come bite you in your rear end. And I thought,
and I think especially with multiple kids,
yeah,
I think talking about it with everyone, that way nothing's a surprise. Like they all know she's getting these injections next week. They all know what to expect, and we're going to go get her some little presents, and let's all kind of prepare for it, versus trying to hide it under the radar, hiding anything with these kind of diagnoses. And ask for help. Like there's already 3 families that are going to bring us dinner that week. They know it's going to be a more difficult week. Like we would do the same in there, and we have now. I think we have given back more because people have reached out to us.
Yeah, I think that's really important for you guys to be able to let people know how they can support you, because a lot of times people hear something, they don't know what to do, so they take a step back.
Yeah, absolutely. I'd say we're more prone as a society to step back than we are forward. Yeah, I won't get into that, but I've been talking about that for a while, more particularly over the last couple of years and in the pandemic.
Yeah, during the pandemic, you've been very vocal about that.
I have been, yeah.
Which is great.
So you heard it here, folks. Mitch says, talk about it.
Hashtag talk about it. No, I don't know if that exists or who owns that. Don't use it.
How'd you learn that? So last question. What is it that your partner does that you know they love you?
I know Mitch loves me when it's a Sunday morning. He takes all 3 of them, lets me kind of settle into the week with yoga and kind of getting all my, once I have the house cleaned, I feel like I'm like ready to start the week, and he kind of knows that about me now. He just kind of does it, and it might not be what he wants to do to start his Sunday or start the week. It may not even be Sunday. It might be Monday morning, whatever, but get the kids all ready in the car. It's just, it's kind of this unspoken, he's just kind of steps it up through the pandemic and just all the time. And I feel really loved when he does that.
For me, I guess it's simple. It's the strive for betterment, not to be complacent and be better tomorrow than you were today, and continuing to, work on things and want mutual, for us to mutually benefit on how we continue to mature and grow up.
That's awesome. Human beings have been sharing stories since the beginning of time to bond and heal and grow. And we hope that by you guys sharing your story, it's enriched your lives and the lives of our listeners.
Thank you so much for
Thanks
having
for
us.
having us.
I want to thank you so much for joining us on Couple Synergy, and for all our listeners for joining us today as well. Our passion is in helping couples and people have happy and healthy relationships, and this podcast gives us a fun way of bringing our knowledge and expertise to you, our listeners. For all of you listening, please subscribe to our podcast and please leave us a review. If you have any questions, comments, or topic suggestions, please email us at contact@couplesynergy.com. For more information about Couple Synergy and our programs such as the Couples Weekend Intensive, our premier program called Couple to Couple, look us up online at couplesynergy.com.
And if you know someone who could benefit from this episode, please download it and share it. And thank you for listening.
Until next time, synergize your life and synergize your love.
You have been listening to Couple Synergy with Dr. Ray and Jean Ketkodian. Couple Synergy was recorded, edited, and produced by Dr. Ray and Jean Ketkodian. Voiceover and music entitled Breathe and Let Go was recorded and composed by Gina Gonzalez.